PML polyomavirus. PMP pseudomyxoma peritonia. PMN polymorphonuclear leukocytes. PMR percutaneous myocardial revascularization. Polymyalgia rheumatica. PMNR physical medicine and rehabilitation. PND paroxysmal nocturnal dyspnea. Postnasal drip. PNH paroxysmal nocturnal hemoglobinuria. PNM perinatal mortality. POD postoperative days. Post-posterior. POX peroxidase. PP pulse pressure. Postpartum and postnatal. PPCS prolonged post-concussion syndrome. PPD, packs per day, cigarettes. Postpartum depression. Postnatal depression. Purified protein derivative. PPH, postpartum hemorrhage. Primary pulmonary hypertension. Procedure for prolapse and hemorrhoids. PPI proton pump inhibitor. Preterm premature rupture of membranes. PPS post-polio syndrome. PPT precipitate. PPTL postpartum tubal ligation. PR prothrombin ratio. PR. Per rectum. PRA plasma renin activity. PRBC packed red blood cells. Premature infant. Premature birth. Preparation. Prolonged reversible ischemic neurologic deficit. PRN as needed. Prognosis. Premature rupture of membranes. PRP panretinal photocoagulation. Progressive rubella panencephalitis. PRV polycythemia rubra vera. PSA prostate-specific antigen. PSGN post-streptococcal glomerulonephritis. PSH psychosocial history. Past social history. PSP phenylsultaline. PSS progressive systemic sclerosis. PT prothrombin time. Physical therapy. PDA percutaneous transluminal angioplasty. Post-traumatic amnesia. Prior to admission. PTB pulmonary tuberculosis. PTC percutaneous transhepatic cholangiography. PTCA percutaneous transluminal coronary angioplasty. PTD prior to discharge. PTH parathyroid hormone. PTHC percutaneous transhepatic cholangiography. PTSD post-traumatic stress disorder. PTSS post-traumatic stress syndrome. PTT partial thromboplastin time. PTX pneumothorax. PUD peptic ulcer disease. PUO pyrexia of unknown origin. PUVA serolin UVA. PVC premature ventricular contraction. PVD peripheral vascular disease. PVFS post-viral fatigue syndrome. PVR pulmonary vascular resistance. PVS persistent vegetative state. Pulmonary valve stenosis. Plummer-Vinson syndrome. PWP pulmonary wedge pressure. PX physical examination. Prognosis. QALY quality adjusted life year. QNS quantity not sufficient. RA, refractory anemia. Rheumatoid arthritis. Right atrium. Rad reflex anal dilatation. Right axis deviation. Reactive airway disease. Rad Heiss radical hysterectomy. RI radioactive iodine. RAPD relative afferent pupillary defect. RAS renal artery stenosis. RBBB right bundle branch block. RBC red blood cells. Red blood count. RBLM recurrent benign lymphocytic meningitis. RCA right coronary artery. RCC renal cell carcinoma. RCM restrictive cardiomyopathy. Right costal margin. RCT randomized controlled trial. RD retinal detachment. RDS respiratory distress syndrome. RDW red cell distribution width. REM rapid eye movement. RF rheumatoid factor. Rheumatic fever. RFLP restriction fragment length polymorphism. RFT renal function test. R/G/M rub/gallops/murmurs. RH rhesus factor. RHD rheumatoid heart disease. RHF rheumatoid factor. RIA radioimmunoassay. REBA radioimmunoblotting assay. Rice rest, ice, compression, and elevation. REMA reversible inhibitor of monoamine oxidase A. RIND reversible ischemic neurologic deficit. RL ringers lactate. RLE right lower extremity. RLL right lower lobe. RLN recurrent laryngeal nerve. Regional lymph node. RLQ right lower quadrant. RML right middle lobe. RNA ribonucleic acid. RNP ribonucleoprotein. RNV radionuclear ventriculography. ROM range of motion. R/O rule out. ROA right occipital anterior. ROP right occipital posterior. ROS review of systems. ROSC return of spontaneous circulation. RPGN rapidly progressing glomerulonephritis. RPR rapid plasma reagent test. RR respiratory rate. RRR regular rate and rhythm, pulse. R cell Reed-Sternberg cell. RSI rapid sequence induction. RSV respiratory syncytial virus. RT respiratory therapy. Reverse transcriptase. RT-PCR reverse transcriptase polymerase chain reaction. RTA renal tubule acidosis. RDC return to clinic. RTS revised trauma score. RU right upper extremity. RUL right upper lobe. RUQ right upper quadrant. RV residual volume. Right ventricle. RVAD right ventricular assist device. RVF right ventricular failure. RVH right ventricular hypertrophy. RVSP right ventricular systolic pressure. RVT renal vein thrombosis. RX prescription drug. SX symptoms. S1 first heart sound. S2 second heart sound. SA sinoatrial node. SAB, staphylococcal bacteremia. Spontaneous abortion. SAH subarachnoid hemorrhage. SAN sinoatrial node. SAPS simplified acute physiology score. SARS severe acute respiratory syndrome. SB small bowel. SBE subacute bacterial endocarditis. SBO small bowel obstruction. SBP systolic blood pressure. Spontaneous bacterial peritonitis. SCC squamous cell carcinoma. SCD sudden cardiac death. SCLC small cell lung cancer. SCID severe combined immunodeficiency. SDH subdural hematoma. SEM systolic ejection murmur. SERT serotonin transporter. SFA superficial femoral artery. Serum folic acid. SGA small for gestational age. SGOT serum glutamic oxalotic transaminase. SGPT serum glutamic pyruvic transaminase. SG-Cath Swan-Ganz catheter. SHX social history. Surgical history. SHBG sex hormone binding globulin. SI international system of units. Suicidal ideation. Seriously ill. SIAD syndrome of inappropriate antidiuretic hormone. 6 surgical intensive care unit. SIDS sudden infant death syndrome. SIMV synchronized intermittent mechanical ventilation. SID stress inoculation training. SK streptokinase. SL sublingual. SLE systemic lupus erythematosus. SLEVST. Lewis virus. SLR straight leg raise. SLL small lymphocytic lymphoma. SM sclerosis multiplex. SMA sequential multiple analysis. Superior mesenteric artery. SMA7 serum metabolic assay. SMS senior medical student. SMT spinal manipulative therapy. SMV superior mesenteric vein. SN student nurse. SNB sentinel node biopsy. SNP sodium nitroprusside. Single nucleotide polymorphism. SNRI serotonin norepinephrine reuptake inhibitor. SNV Syn-Nombre virus. SOAP subjective, objective, assessment, plan. SOB shortness of breath. SOBO short of breath on exercise.